Hello, class. Team 1 was assigned to explore the adoption of computer-assisted coding systems. Today's presentation will be presented by myself, Kim Hernandez, Michelle Almaraz, Catherine Kavanaugh, and Joanne Mejia. In this presentation, we will cover different models that Team 1 has developed in order to analyze the adoption of CAC. These models include the project scope, an entity relationship diagram, the requirement analysis, change management, and an executive summary. Let's first look at the project scope. In order to plan our project, we developed a project scope to identify key deliverables, assumptions, constraints, and deadlines. Our primary deliverables were the CAC system and an easy-to-follow training program for all employees. When CAC was first introduced, many coding professionals were worried that the technology would take over their jobs. Over time, this has proven to be false. CAC helps coding professionals perform their jobs even better. Our training program will help coding professionals transition to the new system. With the adoption of the CAC system, we assume that coding accuracy will improve, which will in turn increase reimbursement. Coders will be billing claims out more quickly as their tasks have been reduced to scanning automated codes. Because we're billing more claims in a day, we will get paid faster. We also have identified a few constraints within our project. The fixed budget is set to $400,000. We must discuss with the vendor that this covers hidden fees, software licenses, and updates. Another constraint is training support. We will only have training support after we go live for only 6 weeks, so we must take advantage of the help while we can. After the vendor contract has been signed, the estimated completion date is approximately June 2020. This allocates time for the system to be installed, for training to be delivered, and complete successful testing of the system.
Hi, my name is Joanne Mejia, and we did an entity relationship diagram, also known as the ERD, ER diagram, or ER model, on computer assisted coding software. The ERD contains different symbols and connectors that visualize two important information: the entities within the CAC system scope and their interrelationships among these entities. We identified 12 entities, and these are the rectangles, starting with patient, a medical record, and ending with payment. If you look at the ERD, we have quite a few attributes, and these are the ovals. Some of the attributes we listed for patient are patient name, date of birth, and gender, among others. Then we show the relationship between these entities with diamonds, and connecting these relationships are links or lines. For instance, in the case of patient, we have patient has episode of care. We also show the relationship of one to one, one to many, many to one. For instance, the patient can have one to many episodes of care. Our goal was to illustrate the relationship or connection with the CAC coding software when the patient comes into the facility and has an episode of care with the provider. Then the visit is coded by the CAC software by going over documentation that was done by the provider. Then the coder verifies the information. Next, the claim is sent to the payer. Finally, the patient or insurance or both make payment to the facility. Requirement analysis. Standards are made to be followed by everyone that works in the hospital system. If one fails, the system can fail. Security breaches are common when there is a break in compliance. Some standards include compliance with industry standards to comply with all regulations and standards set forth by the hospital. Consistent code quality to establish following and enforcing a style towards removing the inconsistencies that arise out of individual ways of doing things. And software security is an idea implemented to protect software against malicious attack and other hacker risks. Data quality, data exchange, and data reporting are requirements to consider when ensuring the system we are managing is compliant. Data quality management is a process used to manage the integrity of the data that has been collected, applied, stored, and analyzed. HL7 standards provides the framework for the retrieval of electronic health information. Reporting data is a functional requirement of the system. Continuing with requirement analysis, in order to have an efficient and effective system, we must consider how it will operate and the technicalities, all while remaining compliant. The identified requirements will help serve as a basis to ensure that the system flows smoothly and reduces risk. All data must be encrypted. Corrections or code overrides made by a coder will be time-stamped and recorded in a log, and system will use natural language processing to identify correct codes for patient diagnoses. A covered entity that implements a software such as computer-assisted coding system, specific security measures must be considered. Some areas to analyze are the technical hardware and software being implemented or already in place. Security rule to protect the privacy of patients' information while allowing covered entities to adapt new technology. Rules are to ensure the confidentiality, integrity, and availability to PHI. Organizations are required to perform risk analysis to evaluate potential risks, implement security measures to address identified risks. HIPAA has safeguards in place for covered entities to implement, such as administrative, physical, and technical safeguards to ensure confidentiality of patient information, manage risks or threats to data against any unauthorized users.
Hi, my name is Catherine Cavanaugh, and I'll be discussing change management. Change management is an important part of working through a project. This step identifies why we are doing what we are doing and how we are going to get the change implemented. We identified multiple areas that will be impacted for implementing the computer automated coding, otherwise referred to as the CAC system. First step is to determine our objective or goal. Why are we making this change? How will the organization benefit from the change? With computer automated coding, we are standardizing the processes of automated coding. The purpose is to mitigate risks and increase efficiencies. Some deliverables include productivity improvement, code selection accuracy, a reduction in roles, along with the creation of new ones. Establishing project constraints is also a necessary step. Identifying how much time you have, what are your timelines, what are your hard stops, etc. How much money are we budgeted, and how long do we have vendor resources after go live. As mentioned in previous slides, we've already set our budget and our go live date. Then we need to determine our minimum quality threshold to be about 99% coding accuracy, and then took into consideration that there are 3 major holidays approaching that will take time and resources away from this project. We were also able to identify deliverables that would be subject to change management, including primary deliverables such as a new CAC tool, employee training, multiple secondary deliverables such as less time spent in manual coding, higher quality outputs, data reporting tools, etc., that will all be impacted by change management. So mapping out our current workflows for coding and a proposed workflow with a new computer automated coding tool helps identify all the elements that will need to be subject to change during this change management process. Next up, I'll be talking about the change management needs. I know this slide seems very busy, and I'm not going to bore you with reading it. This is just to visually show you only a small piece of everything that you need to be aware of when making a change to use a computer automated coding system. Personally, I've been on many projects, and determining everyone who will be impacted is a tedious task and is also only successful if everyone gives input. What do I mean by that? Well, when a project manager is assigned to a project, they're only given a few contacts, typically the ones who wanted the change in the first place or wanted the project set up. They're merely there to update issue tracking logs, give high-level status updates, and in general, just make sure the project is meeting its targets. As conversations are taking place with the PM is relying on everyone at the table to make sure that others are included. Therefore, we all need to ask ourselves, does IT need to be involved? What about HIM, coding, clinical informatics? Are there any physician liaisons that need to be included, etc.? Everyone plays a part in the change, and it's everyone's responsibility to notify others of the change that might be impacted by it. As you can see in our change management needs section, everyone plays their own part in making sure this project continues to meet deadlines and has their very specific role in ensuring a system such as CAC is successfully implemented. Lastly, I'll discuss other areas to consider when implementing the CAC system. You need to estimate the volume of change. Our budgetary impact for this project fell between 50,000 and 75,000, and we assume the total number of change requests will be roughly 30 to 50, taking approximately 150 to 250 hours to complete. Roles and responsibilities for this project will fall on the facility owner, HIM director, compliance officer, along with IT manager, EHR system analysts, coders, clinical documentation integrity specialists, along with a few others. So everybody has to know their roles and responsibilities on the project. Then, since so many changes will need to take place for the computer automated coding tool, the PM will develop a change management process for doing so to track, evaluate, approve, or deny the change, and then integrate it and communicate it out. Then tools to use for such coding process changes would be change request form, issue tracker, and most important, the master document mapping matrix, which identifies all the documents that will be mapped to the CAC system. Then lastly, what are the recommended projects after the CAC implementation, such as define the new roles that will be created, determine what additional duties existing roles will have. Some of these impacted roles are coding compliance, coding auditors, data analysts, etc.
Executive Summary by Michelle Almaraz. You're probably wondering, why did our team come up with a computer-assisted coding software? Well, let me give you a few details showing how it can benefit the healthcare facility. According to the American Health Information Management Association journal, one reason is medical coding has become more complex by having an increased coding standard due to new reporting requirements. Examples include the Health Information Technology for Economic and Clinical Health Act, HITECH, correct coding initiatives, and payer-specific coverage policies. Another is effectively transitioning from ICD-9 to ICD-10. Now, is there alternatives? Why, yes, there is. According to Bozzoli, there is one alternative. 3M has a compatible software called EasyCoder from Alpha 2. This is a web-based coding tool that enables administrative and clinical staff to look up codes, perform edits in one program. Now, benefits. We need those benefits. There would be a 45% increase in coder productivity, a 98% increase in accuracy, and a 19% increase in net revenue. Now, this is all according to the 3M website. Now, outcomes. There are outcomes. The adoption and implementation of this CAC system will improve many factors in the Health Information Department. But no need to fear. It will not take over and make people lose their jobs, but it only helps increase in productivity. Also, it reduces claim denials, results in faster claim processing and quicker reimbursements. And there is no need, I say again, no need to hire more staff since it will increase the accuracy and productivity.
These are the references we use to complete our PowerPoint. And on behalf of Team 1, thank you for listening.